Hello, I'm Karen Cafanteris with AARP Michigan, and I want to welcome you to today's event about low back pain, its causes and solutions. I know there's a lot of interest about this. We've had a lot of people sign up for this presentation, so I really think that you're going to get a lot of great information. So I'm the Associate State Director for AARP Michigan, and I want to thank you for joining us today. And I want to point out, which I'll share with you at the end also, you found out about this program in any number of ways. You might have received an email, you might have received the information from a friend, you might have received a mailer from us. We have lots of great programming happening virtually. And to find what else we're doing, you can go to the AARP Michigan website, which is aarp.org/mi, and click on the virtual events link. And there we have all kinds of different things listed for the upcoming month. And then we also have recent past events that you can watch on demand. So without further ado, today's presentation, we are going to, first I need to point out how you ask questions. Throughout the program today, feel free to put your questions in the comments on Facebook or YouTube. If at about halfway point, we're going to answer a couple of those questions, and at the end, we're going to take all the rest of the questions that we can. We're on for about an hour, maybe a little more, maybe a little less. It all depends on how many questions that we have. So let's get moving. I want to introduce to you Matt McFadden. And Matt, let's just bring Matt on the screen real quick here. There we go. Hi, Matt.
How are you, Karen?
Great. Matt McFadden is the clinical director at Peak Performance Physical Therapy. He earned his bachelor's degree in health fitness and his master's of science in physical therapy from Central Michigan University. He's also a graduate of the Oakland University Orthopedic Manual Therapy program. Matt is the clinical director for the Michigan State University Kinesiology program, as well as for the physical therapy programs, or for physical therapy programs throughout Michigan. He has served as a resident instructor for the OMPT program at Oakland University. He has also has 12 years of experience treating patients with orthopedic conditions, and he specializes in the treatment of spine, shoulder, and knee. Matt is a member of the American Physical Therapy Association Sports Physical Therapy section and the Michigan Physical Therapy Association. When he is not helping people become the best they can be, he enjoys being outdoors during the summer and spending time with his wife and daughter. So welcome, Matt. We're thrilled to have you. And I want to just have you start right in with the presentation.
Sure. Thanks, Karen. Welcome, everybody. Thank you for taking the time to listen in, to watch here. Hopefully you'll leave here with something new that you learned, or have some of your questions answered about, maybe your own back pain, or somebody that you love or know their back pain, to give them some better information. I truly believe, knowledge is power with some of this stuff, and there's a lot of information out there about things like back pain. So I'll do my best to explain to you in terms you guys can understand, some of the things that you can do when you have back pain. And I'll premise this with the fact that I've personally had back pain. I'm not, just talking about something. I've only treated patients with it. I've had, a pretty substantial case with some back pain in my life, and I've had to kind of work through it. So for any of you out there who have had back pain, I know your pain. I felt it. So I can emulate, or I'm with you and what it feels like. I've had the stuff go down my leg. I've had my foot go numb. I've had it where I couldn't stand up straight. So I know your pain, and it's not fun to deal with. And so knowing the ways to kind of work through that, or how to manage that, I think is critically important. Hopefully you guys will learn some stuff as to what you can do. So I'm gonna move forward again. You don't have to live with back pain. It's not something that 80% of people do have back pain over the course of their life. So it's something you might run into, but it's not necessarily something that you should be living with every day, or you should be trying to do something about it. So some of the objectives, what we're going to go over today, is learn some of those common causes of it, look at potentially some of the things with ergonomics or how you're sitting or setting up your workplace or your home office, as a lot of us are doing these days. And what are your options if you have back pain? Because that's something that not everybody's sure of what their options are. Karen wonderfully explained some of my background, and this is just kind of going through some of that stuff, but I have had like a 2-year residency program in treatment of the spine and some of the spinal techniques through Oakland University. That really, got me more knowledgeable on the spine and how to manage it and all the intricacies of the problems that you can have with it. And so you may look at this slide and say, well, what does this mean? And so the goal of this slide is to, if you see the arrow on the right for the current flow of healthcare, is to understand kind of what typically happens with someone who maybe has some back pain. So they might say, okay, I'm going to go see my doctor, and they're going to say, okay, yeah, you hurt your back, and let's take some pain meds, take some ibuprofen, take some Tylenol, maybe they prescribe some muscle relaxers, or even some more heavier meds if your pain's bad enough and you feel like you need it. You come back to me, see me in 4 to 6 weeks, and then you're like, oh, well, I'm still having trouble. They send you maybe somewhere else and, consult on potentially getting your back injected if you're still having a ton of pain. And you can see that, there's a large cost with all those things. Just keep taking meds or go get an injection, because that can cost you a lot. We know deductibles are continuing to increase. So I've seen patients that have a deductible of $4,000 or $5,000. So a lot of that initially can come even out of your pocket. And then for some of the worst case scenarios that, people do need surgery for the back, that can be upwards of $40,000 to $90,000 for a back surgery, depending on what's done. And the point is, at the top, physical therapy, we're movement specialists, right? We analyze movement. We work with people that have things like back pain and neck pain, knee pain, shoulder pain. But we're pretty conservative in regards to how much it costs. Usually it's around 12 visits, about $1,100 is what would cost to your typical insurance, or what it costs the individual. And so where does your healthcare money go? You can kind of see where that goes with this a little bit when we're dealing specifically maybe with back pain. And everyone always wants their money to go further. And we're just indicating a little bit that just taking medication isn't always the best way to do it. And there may be some other good utilization of your money or what you're paying for, especially when you're paying a deductible, and what some of the first course maybe should be. And so I would advocate that this pyramid probably should be flipped a little bit. And so you can see kind of what I think it should look a little bit more like, with that flipped over where the red part was the physical therapy. And now that's kind of on the bottom. And that really should be, the first course that people do. And so it would look more like this. Let's try some of the conservative routes. Let's not rely on pain medication if we don't need to. Let's not potentially have to hopefully get to things like injections or surgery. A lot of times conservative management with physical therapy can help most people with back pain kind of work through it, where they don't need the more aggressive interventions, such as maybe injections or surgery. Or if we're not able to get it there, then we can work with them with injections as well. But if you're having back pain or something like that, obviously you can see your physician, but you should consider that physical therapy could play a good role in that. And your physical therapist isn't trained, or your primary care physician isn't necessarily trained in all the intricacies of it, or assessing all the ways or what exercises should be good. And I would implore none of you to just only go on Google and search like, what do I do for back pain, and just take some exercises you found and try to do them. There's obviously good information out there, but there's a plethora of information out there. And I would encourage you to, take it straight from sources who can give you individualized, specific, tailored treatment to you. And that's where, again, taking a little bit of time and effort to go through a course of physical therapy if you have a back pain, I think would be well worth your time and investment. And you can see it would be a much smaller investment than some of the other things that it could be. and hopefully help you get back to your prior level of function much sooner. So I'm going to pose a few questions, and you guys will be seeing a Facebook poll that's going to be coming out with like, hey, what are some of the things you're experiencing? I want to know. I'll go into those in a little bit of some of the most common kind of buckets you could fall into of where your back pain is coming from. And then if you can respond in the comment section, then we'll be able to see some of those, and we'll be able to talk about those a little bit later. But what pain are you experiencing if you're on this, if you're watching this? You know, are you experiencing just pain in your back? Are you experiencing pain that shoots into your butt and down your leg? Are you experiencing, you know, trouble walking, trouble bending, trouble lifting, those type of things? So go into the comment section and answer some of those questions, and look for the Facebook poll question as well. And we'll be looking to, again, kind of respond to those in the near future. All right, I see someone coming in, so that's great. Thank you for putting in some comments in there. So I want to talk now a little bit about what the top causes of some of back pain are. Actually, I'll step back for a minute and just look at a few of the things that maybe came in from a few of you watching there. So, you know, one person responded, I'm just glad that you can feel my pain. So I appreciate that. And some of the things they're feeling are maybe some symptoms consistent with some, you know, spinal stenosis, which is a narrowing of where the nerves go out in the back. And then we, you know, ask them some questions about those treatments. Somebody else is asking about demonstrating some exercises. It'll be a little harder to do in this instance, but that's what I would refer you to talk to your physical therapist, because they're the ones who can give you the real intricate pieces with some of those things, because it depends on kind of what your symptoms are to determine what specific exercise program you would do. And somebody else asking questions about what do you do if you've had a fusion or a laminectomy, which is basically laminectomy means they open up some space if they had to do a surgery. And the fusion is where they actually have to, 2 levels of your spine, they actually use something to hold them together if your spine is having enough problems. And so, you know, still having pain in the foot, numbness in the foot, pain down the leg, heaviness in your legs, those are definitely some common complaints that patients have from back pain, where they get the nerve pain down the leg. And if you get a kink in the hose, right, and you're not getting that signal down to your legs, then you can run into some of that other stuff. Another question coming in about low back strains. And so again, we're going to address these here in just a minute here. So, and somebody responding as well, hey, went to physical therapy, kind of, you know, didn't work, had to have some surgeries and injections. So we'll address a couple of these. And again, there's going to be time for questions afterwards. So remind you that we can also get into any specific questions after that. So, but what are some of the top causes of back pain? The herniated disc. And this, I can speak to you again personally. This is kind of what happened to me. I herniated my disc and started having pain running down my leg into my foot, and eventually caused, you know, tingling and numbness in my foot and troubles in my back. Degenerative disc disease sounds confusing. Sounds like, what does that mean? That's kind of a little bit of an umbrella term, or more specific for some of the arthritis you would get in your back. But arthritis can mean a lot of things. It can mean some spurring. It can mean some breakdown of the disc. It can mean a lot of different things. But that's definitely another thing that can cause some of the back pain, and then a muscle strain. And I think probably everybody who's watching this has experienced some degree of a muscle strain at some point. But people get confused as to, is their back pain just a muscle strain? I'll talk to that a little bit more. So learning a little bit about herniated discs. I know it can be confusing. You can see some of the image there on the bottom right there, where you see something pushing out on the yellow things, which are the nerves. And again, this is a situation that I fell into, what classification I was. I was lifting some weight, heard a pop in my back, and I herniated my disc. And so that disc pushed out and pushed on the nerve. And that can be very painful if anybody you've experienced out there. Some people also might be called a bulge disc or a slip disc or a ruptured disc. It's all the similar terminology for a herniated disc. The things in between our vertebrae, the discs, are just like that jelly donut example. So there becomes a breach in the outside, like the hole where the jelly goes in, and you put some pressure down on it, it would push the contents of that disc back out onto the nerve. And then there's certain positions that can make that worse. Usually a flexed and rotated position will make that stuff worse. And that's where most people's lifting injuries occur. They are bent forward, twisted, and then when they try to lift up from those positions, that puts the most strain on the backside of the disc. And that's where it can actually tear it and rupture it and have the herniation. Discs that have become herniated are usually in the early stages of degeneration. So once further degenerated discs tend to actually be stiff and they don't necessarily have herniation, there's usually other issues going on with that maybe there's more bone spurs or there's more other things that can cause some other symptoms with that. But you'll see more herniated discs in probably a patient population that's more from, 30s, 40s, 50s. You can still see them. You get into the 60s and 70s, but there's more of the degenerative disc disease or arthritis that usually becomes some of the symptomatic there because the disc becomes less water content and it's less mobile there. So this usually happens a little earlier in life, but lead to more chronic problems later if it's not managed well. So how many times have you probably heard somebody say, hey, I strained a muscle in my back. I lifted something, I strained it. What I would say is that a lot of times, whenever I hear people say, oh, I strained my back, and then it's 6 months later and they're still having the problems from what they considered a strain, I would tell them that any muscle strain, unless you consistently continue to kind of re-pull on the area that was strained, will get better in a few months. Will settle itself down because when you strain a muscle has a rich blood supply. And so it gets nutrients in and wastes out and will heal very quickly if you just strain a muscle versus like tearing a tendon or something like that. And so they often occur in the low back if you do strain your muscle because you lifted something too heavy. And that definitely does occur. But most of the time that gets better in a short period of time. And you can potentially have a little bit of swelling and muscle spasms with it. But I would say that within 2 weeks or 3 weeks, if you had a muscle strain, you should be feeling like it improves. And so if it's not improving substantially, then it's probably more than just a muscle strain. Like you might have did something to the joint or to the disc or to some of the other tissues back there. And that if you truly have a muscle strain, you shouldn't be experiencing pain that radiates down your leg. You shouldn't be having nerve symptoms like the tingling, the numbness, and things like that. And so hopefully that gives you a little better idea of if you have some of your pain, maybe what are some of the things that could be coming from. Now, the degenerative disc disease is, and you can see that picture there, it looks like there's not clean lines on the vertebrae there. There's like the edges are ruffled a little bit. They're not nice square shapes in the vertebrae because we get, bone spurs that develop, and those can creep into the spaces where the nerves go out, and that can cause compression on the nerves. And you get enough of that in enough places, and it can be causing some of those symptoms down your legs. And sometimes that works into actually causing some stenosis, which is another word for narrowing and that can cause pressure on the nerves as they come out, or even the nerves as they go down the spinal canal. And so degenerative disc disease doesn't necessarily increase with age. There's age-related changes that happen to everyone's spine. No one's spine is going to look perfect on an MRI. If you had an MRI to your spine, it'll show some degree of degeneration, but that doesn't necessarily correlate 100% with pain. And so there's more and more image testing that's done. So there's more and more MRIs that are being done now, and that's fine. That gives good information, but you always have to correlate what it shows on those MRIs with the symptoms you're having, and that's got to correlate to kind of the exam that's being done. And I think that can get confusing to people because their reports of their MRIs may look really bad, and they think, oh my gosh, I have all these problems, but there may be only one area of those 3 problems identified are actually what's causing their pain. And so you can have plenty of degenerative change without having a ton of pain, but it also can contribute to symptoms that you would get. And this could be pain right in your back. It also could be pain that goes down your legs. And kind of like it says in there, it's caused by wear and tear. And so it's very important to manage your posture. It's very important to manage the spine position when you're bending and lifting, because that limits some of that wear and tear. And if we can limit some of the wear and tear on our spine and transfer it appropriately, like through your hip and through other areas, then ultimately it'll slow the degenerative process. And so we want people to move efficiently. We want them to move well. And that's something that in physical therapy, we work with people all the time on, because I can't change your spine I can't change the degeneration that's happening in your spine. I can't change if your disc is herniated, but I can change how you move and the loads that are placed on it. And those are things that can be changed in a matter of time and can lessen your symptoms and help control your back pain. But not everybody knows exactly how to do that. So those are the things that how physical therapy can be something that can help you, because you might not know that your spine's not in a good position, or you may not know the best way to transfer those loads and potentially help slow the degenerative process. So those are things that you could be doing or that you could get feedback on, and those are things that you can change, as well as how to stretch the right way. What muscles should I be working, and that are individually specific to what's going on with you. Not just, well, my back pain's the same as everybody else's, and so I should do these list of exercises that I found online. So why do over 80% of people experiencing back pain in their lifetime? It's a good question. And there's not just a black and white answer, but there's many things that contribute to it. And I'm going to kind of go over a few of them that do. So our posture can contribute to that. Are you always sitting in a flex position? Are you always straining your ligaments? Are you always putting a load on the backside of your disc? Because if you're always slouched, well, then you're always putting a little more stress there. What's your posture like when you lift or when you carry? The position of your back makes a difference. And the simplest way to look at that is to think about a column, right? Your spine is a column. And so it follows column mechanics. Think about if a nice straight spine, how much load that can hold, right? A nice straight column, it can hold up buildings. But if that column was turned or twisted, it can crumble very easily under the same load. And so think about your spine in that same way. You've got to keep your spine straight when you're putting loads through it, and it'll do much better. Now, of course, everybody knows that a sedentary lifestyle could contribute to issues with your back, right? There still is, you put a lot of movement through your back, there's no way around it. So if you have good strength and control and you have strong hips, those all can help limit some of the load that goes through your back. And a sedentary lifestyle doesn't affect that. So you might say, well, I can't go lift weights or I can't go do this. Well, I would say if you can walk, because that's good for back pain just by walking, because that doesn't load the spine up much more and it keeps things mobile. It keeps your hip mobile. And that's one of the best things you can do for back pain is to walk. If you can do it comfortably, you don't have other medical conditions that limit you doing that. One of the things that lack of preventative intervention. It's again, kind of come back to knowledge is power. What do you do if you have some back pain? Well, I would rather see somebody come to my clinic where for the first time they ever had some back pain, even if it's not really bad, and I can teach them some good things to do when it comes back. Or I can educate them a little bit instead of wait till it's a 5-alarm fire and they can't do anything. And then try to manage that pain becomes much more difficult. But if they know a little bit at the get-go, and they learn some of those things, or they learn what's the best way to go at it. Should I take a little bit of anti-inflammatory? what should I do here? Should I take some Tylenol? Should I stretch? Should I strengthen? Should I lay down and rest in bed? Most people don't know. Now, back a long time ago, most people said, well, just lay around. And we've learned that that actually makes you weaker, and that actually prolongs how long the back pain will stay around. We want you to be as active as you can when you have back pain, and that'll usually helps work through it. Because if you're not, you'll actually get weaker, and it makes it harder to go away. Obviously, overuse. If you overdo your back, weekend warrior, hey, I'm going to go out there and I'm going to split some wood, and then I'm going to lift, tons of wood up into the back of a pickup truck, or I'm going to do something like that. I'm going to lift and do a bunch of that stuff. Those are all things that could obviously aggravate the joints and the discs and the muscles. So anything you're introducing something new, try to do it in a graded amount. Do a little here, do a little there, or if you're going to do something more aggressively, do it for 10 minutes, take a break for 2 or 3 minutes, give your back a break, and then go back at it again, or break it up like that. And just to give your back a little rest in between can be helpful. And I've seen a couple of comments that have come in about, hey, I lost a couple inches. Fortunately, that's due to not just gravity, but it is due to the fact that you can lose some of the height of the disc. Just like if you've heard about somebody's knee goes bone on bone, they actually lose a little bit of height there because the cartilage is worn down, so they lose a little bit there. Well, the same thing can happen in your spine. If you have breakdown of your disc, it actually shrinks a little bit. And if you get multiple levels of that throughout your whole spine, you can see how a millimeter here, a millimeter there, all of a sudden you could be an inch shorter. And gravity adds compression to your spine. And so we treat a lot of the spinal conditions with a little bit of decompression, or we call it traction. And that can give the disc a break and can take away from some of those discs that are herniated and pushing on the nerves. So those are some of the things that can contribute to back pain over your course of your lifetime. And if you can check a couple of those off the list, that hey, I manage my posture. I don't sit for longer than an hour. I know some things I could do because I've talked to my physical therapist. I make sure I stay a little bit in shape by walking a mile every day, and that helps me keep myself conditioned. So when I need to use my back, I don't hurt it. Those are things that you can be proactively doing to keep your back in good shape. And so sciatica is the other one. And so sciatica refers to that pain, like I mentioned earlier, that radiates down the leg. And that is no fun to have for any of you guys have had that. I've had this, and you can see it's kind of like the tree, part of the, you get pressure up on your back, but then you feel it down your leg. You might have muscle spasms. You might have tingling, you might have numbness. Those are all neurologic symptoms. You may feel like, you can't put weight through your leg. You might feel like you can't bend over because it pulls your nerve and that stretches it even more, and it's already unhappy with you. And so it typically just affects one side. So if any of you are out there and you're having symptoms that go down both your legs, it's probably not sciatica from like a herniated disc pushing on one spot. That could be something more like stenosis, where you're getting something where the nerves go down the canal of the spine and they get pinched there. And that's a little different situation. But typically, if you're just having sciatica, it'll only be on one side. And it often causes pain, inflammation, and numbness. So sometimes, again, here, some of the non-steroidal anti-inflammatory medications can be helpful. But really understanding how to manage it by looking at an individual program from your physical therapist will help you with that. I think we're going to take a short break, talk to Karen again. Karen, come back on, look at some questions and kind of go from there.
Let me unmute. There we go. Just have to remember to unmute. Sorry about that. Great information. Thank you so much. And you have more great information coming. Before I get to a couple questions, I wanted to just touch on something we touched on at the very beginning. So can you tell us what the difference is between just a person with a physical therapy degree and someone with the additional, the OMPT, the osteopathic manual physical therapy?
Sure. And so the credentials next to my name are OMPT. That means Orthopedic Manual Physical Therapist. And so there's variations of that depending on where you're getting trained. But if you saw something that said OMT or NI OMPT, usually if it's something that says like Orthopedic Manual Therapy, they're going to have that extra little knowledge base on assessment and treatment of the spine and the hands-on approach. And so I think that those are some of the things that really were honed in on my additional education, my kind of like residency that we did. It's how to actually assess, treat, fine tune which segment of the back is it coming from? Is it the nerve? Is it the muscle? Is it the joint? And so if you're searching for a physical therapist in your area, and they're going to run, I think, a banner a little later, send some links out. You can go to find a PT at a link there. There's also some great information at a similar site about where you can look at some of the different conditions other than back pain. For example, if you had Achilles tendonitis, something with your Achilles, or if you had, a knee problem or a rotator cuff problem, there's some very credible information that's, again, when you're talking about, Dr. Google or just search Google, there's a very credible information about updated evidence-based stuff on this website that you're seeing that comes up through there. So I definitely would click on that if you're looking for good advice that's directed kind of along the lines of how physical therapy might help some of those other conditions that we truly do treat. But if you're searching a physical therapist in your area, search physical therapist, and you search, you don't necessarily have to search OMPT, but you could search, manual physical therapy or orthopedic physical therapy, and look for some credentials next to the name that would be regards to that, like OMPT or NIOMPT or OMPT. Those are the people that are going to have a little more specialized training, because to get those credentials, you've got to go above and beyond to get them and have that extra knowledge base.
And my personal experience is that the OMPT, it's like you said, it's hands-on, it's manual, and I've shared with you before we started that I had been to a couple physical therapists who didn't help me at all, and then I found peak performance, and a huge difference. I definitely have had a lot of a help from the physical therapy from the OMPTs there. So, okay, to our poll question, what have you done about your back pain? So 16% of people said that they ignored it. 24% spoke with their doctor. You like this one? 41% said they went to physical therapy, and 19% had surgery or injections. So good to know people are going to physical therapy. I would just, my personal recommendation is, if you went to physical therapy, you didn't get help, you didn't feel like it helped you, make sure that you might want to try it again with someone with that additional credentialing, because it really makes a difference. So we've had a lot of questions, and one of the questions that I thought a lot of people, someone asked it, and then a lot of people went ditto. I want to ask that same question. What's the difference between from physical therapy care versus chiropractic care for back issues?
Yeah, that's a great question. And, think about it this way, right? So, you go to a chiropractor and you'll be probably manipulated in some shape or form, right? Typically in older spines, they might not be actually doing where they try to make a pop, but they use a different tool or something like that to try to mobilize the spine. And obviously there's those areas that are similar, right? As physical therapists, we mobilize and manipulate the spine too. But if you have, the easiest way I like to think about it is that's fine. But if you're not using that new motion, if you're not actively doing something or some exercise with it, it becomes harder for some of that stuff to stick, right? You can maintain that additional motion. Or okay, let's say I improve mobility, and let's say your thoracic spine or that rib cage area, and that helped your neck or that helped your shoulder. Well, doing some exercises to facilitate that, to carry that over into your day-to-day function, I think is where the blend that physical therapists do of hands-on exercise to hold the spine in better shape, right? You've got it. spine is a bunch of bones, but you got your muscles and your musculoskeletal system hold it together and help it move. So understanding, you could have somebody move way different because of how they're activating their muscles and how they're doing things, even if their alignment is the same, right? It's because how they're using their muscles, how they're incorporating that. So the physical therapist, in how we treat, we're blending the exercises and muscles and joints together, as opposed to just relying on manipulation to be the sole cause of improvement, that stuff.
I think it's important to point out that as this OMPT, you also do adjustments.
Correct.
So you adjust the muscle, you adjust the spine, and then you have them teach them exercises in order to help keep that spine in the right position.
Correct. And there's multiple healthcare professions that have carryover or crossover in what they do, and that's one of the crossovers there. We just incorporate more additional, training and the rehabilitation point of it, where we're working on muscles to get them stronger and stretching them out.
So at what point do you feel people should seek medical treatment?
So that's a good question as well. I don't think that it's like, oh my gosh, I woke up and I had some pain in my back, I need to rush to the doctor. Or again, in all 50 states, there's a form of direct access to physical therapy, meaning that you could go just walk into a physical therapy clinic and get screened or evaluated and then determine, where to go from there. So that is always a possibility. Obviously, if you've fallen or done something like that, you want to get things cleared out, like make sure you know a fracture or something like that. Of course, you want to see your physician. But if it was a simple flare of something you've had before and you've been to physical therapy, some version of that you can do in every state now. And so we're happy to see that, because we want people just to directly go somewhere. Hey, I sprained my ankle, I need to go do some physical therapy. You get evaluated by a physical therapist and kind of go from there. But to answer that question, I would say that, if you're having symptoms that are lasting longer than 2 weeks, I tell people not to wait forever to go get them, treated, right? Go get seen and try to make that better, and be doing something proactively about it. Because, in a week or two, a lot of things will get better kind of on their own. But if it's not getting better, then I would recommend you take that next step and either get screened by a physical therapist, go see your primary care physician, and your healthcare team, right? We're a team. It's not like you can only see your physical therapist, you can only see your doctor. We both have things that can help you. Maybe that I can't prescribe medication for you, I can't order diagnostic tests for you, and you need to work with both parties. And so it depends on the situation there, but we are collaborating and working with referring physicians on a regular basis so that we can get ultimately, the best care. And I would encourage all of you to actively, want your providers to communicate together, and that ultimately leads to better care. And I think you can continue to see that moving forward in healthcare. If we can do more of that collaboration, you won't be having the same question asked twice, then you'll be getting better individualized care.
Good. All right, we're going to go back and let you finish your presentation. Then when you're done, we'll come back and answer some of the questions that we've gotten. I do want to point out that there's been a couple questions about the website. It has been posted in chat, so people should look for the website to find an OMPT or equivalent physical therapist.
Right. Like I said, you can't put in just credentials on that search there, but if you're searching, let's say, again, I'm in Lansing area, if you search Lansing, Michigan and physical therapist, and then the ones that come up, you can look at some of their credentials and look for some of those things, because that might be the easiest way if you're really looking for somebody right in your local area.
All right, thanks. Well, we'll let you finish the presentation and then I'll be back on the screen.
Sure, sounds good. All right, so I'm going to talk briefly about ergonomics, but I think it's a pretty important topic now. And I'm working from home, a day or two a week, and there's lots of people that are working from home, and not everybody's equipped with the right equipment. And people have been doing a lot better job of it, but at least you should know a little bit if you're at home and where you're at. So 20 inches is an exact number of how far your eye is going to be away. The easiest way is if you reach out your hand here. If you reach out your hand, you should be able to kind of just touch the screen. And if you do that, then you're a pretty good direction away from the screen that you're looking at. And then obviously, like if you're on a laptop, it's not going to be the top of the screen, is probably not at your eye level. So you got to do something about that. And so some people get a second screen, some people put something underneath their laptop and get an external keyboard. But those would be things I would consider if you're spending any length of time on your keyboard, because that can affect the position, potentially even some of the neck stuff you could have there than maybe some of the low back stuff. And then you want to try to get your keyboard set up in a position where your arms can be relaxed at your side, your shoulders are relaxed, and you can type and do what you need to there. Obviously, if there's any glare, you want to try to avoid that because that can cause squinting and headaches and neck tension with that. And then you want to get adequate room for your knees to get onto the desk or wherever that is. The next slide will show you a little bit more. The one thing I would point out with this one is that not every chair obviously has armrests. You can use the armrest, just make sure if you can adjust them, you adjust them appropriate height. Your feet should be flat on the floor, and if you're not flat on the floor but everything else where it needs to be, then put something under your feet. That might be a thick blanket, it might be a couple books. You can get some good use out of the encyclopedias that you still have but never use anymore. And then if you look at the low back, to use a low back support on a chair, you've got to be sitting against it. And nobody's going to sit against it 100% of the time. I fully get that. But being there more often can be very helpful, because that little bit of curve, you can see on how the spine sits when up straight. There's a natural little curve in the low back. And so to have that curve supported is super helpful. Now, if the chair's too low, your hips will be at or below your knees. And that'll automatically throw your pelvis into kind of rolling back and make you slouch. So you can see this one, if there's any bit of adjustability in the seat, it's always easier to sit up straight or sit up better if your hips are slightly higher than your knees. And so I show that to patients all the time. They're amazed at how much easier, even if they try to slouch, they can't slouch quite as far. If you're going to sit there for a while and you're always fully slouched, that's going to be much, much more challenging. So if you don't have a part of the seat that can adjust, you can always even just put like a little bit of blanket or towel on the back end that will raise your hip up just a little bit more and give you a little extra padding. And some people find that to be very helpful. But how you're managing your spine through the hours of the day that you're there can definitely affect the positions that your head, neck, and muscles need to be into, and can keep that more how your spine will function efficiently. So how do you avoid needing surgery, injections, or medications for your back pain? Let me be the first to say, there are plenty of situations when surgery is obviously warranted, right? Injections are needed. We need medications to control some of the pain. So I'm not here saying you don't need any of those things. But obviously, when you can not be relying on those things, you're in a better spot. So what do? Well, you try to be proactive, right? You try to stay, like I said about walking. Walking is good for back pain. Or you're being proactive about adjusting your workspace, for example, to make sure that you're in better positions for your spine so it won't get as riled up. Or if you're into a current flare, you're in a better position for your spine. You can build your healthcare team. Like I said, ultimately, it's more than probably just your physical therapist and maybe your primary care physician. You might have someone you see, physical medicine rehabilitation, who does injections for you, or you might be still, consulting with a spinal surgeon. Work together with those medical professionals to make sure that they're communicating, that each has the information they need to help you make the best choices you can do. And there's more to people than just that, right? If you have other concurrent conditions that could affect some of those things, whether you're seeing a rheumatologist or somebody else in your healthcare team, make sure whoever you're working with knows that. Seek out. Karen spoke about this, right? She sought out some different physical therapists or different physicians that may have been able to help her. And she was able to seek out someone who she trusted and was able to help her meet her needs. So it's fine. Everyone might not meet your needs or be doing what you want, right? Some therapists are going to do more manual therapy. Some are going to do a lot less. If your need is you want some hands-on therapy and you feel that that's important to help you get where you need, then seek that out. And then use, right? Obviously, nobody wants to rely on, just taking a pain med to block what's going on so you can get your day done. You want to try to be actively doing something to make it so you don't need the pain medication, and making smart choices so you don't need to be using, Norco or some of these other more challenging drugs that could be prescribed to you and taking that are addictive. Because I think that most of the time with back pain, it's not a quick fix. And I know that's not what you guys want to hear. Back pain is something that a lot of times I tell people you have to manage it, right? Back pain, the first time you get it, you might come on a little bit, goes away for a month, might come back in 3 months, but then it lasts 3 or 4 weeks. And then it kind of goes away on its own, and it might come back 6 months or a year later, but now it lingers around for 2 months. And so it's one of those things that if you don't manage it well, it can keep popping back up. And so, I would encourage you to really try to be proactive and try to manage that. And then, when you need it, obviously use things like injections and medications and surgery if that's recommended from a surgeon. But I'd also remind you that surgery can always make things worse. And back surgery is complex, and there's no guarantees. It's not like they can just a couple poke holes like the Ken in your knee, do something and get out of there. There's more tissue, more things you're dealing with in there. And so, make those decisions and ask the questions if you are a candidate for surgery to your surgeon, so that you know exactly what you're getting into and what the expected outcomes would be. So that you're not going in thinking, oh, all my problems will be solved, but there's still, chances are you still might have some residual numbness or pain, or this surgery is mostly helpful to alleviate your leg symptoms, but not your back pain. Those are some things as well. So, and so what are some of your options? The survey earlier, I think there was 14% people said they ignored it. I would encourage that 14% of you to really reconsider that. And I know life is busy. I know it's tough to make time for yourself, but if you don't make the time when you're ignoring it, it's going to take you more time later. And I'm pretty confident in most patients that I talk to that if you don't address it when it first comes on, you're going to have to spend time later addressing the ramifications of it. Whether it's how you move, whether it's the things you do, whether, getting yourself in condition to do some stuff. It probably will catch up with you later at some point in your life if you're not managing it initially when it comes on. So I would encourage you not to ignore it. You can live with it, which a lot of people do. They just kind of live with the pain and say, well, that's my new normal. I'm just going to have to be in pain for the rest of my life. That's still not I think the best mentality to go with it. Or you can do your best to take care of it. And that's would be assessing your healthcare team, whether that be your doctor or someone who does injections or physical therapy. But if you're at the interim stages where you're first dealing with some of the back pain, I think that, physical therapy definitely should be, like that pyramid showed, one of the first places you go. And like I said, you can always try, if you've had therapy and it wasn't super successful, then usually your physician is giving you other options, which may be try some injections or consult with a surgeon, or try some other things. And there's nothing wrong with trying on a chiropractor or other things that could help with it. But I would say, don't give up on it unless your pain is so debilitating that like you're losing function, because then you really want to get something done, and you may eventually need surgery. It's not what people want to hear, but there's definitely cases where that is the option. It's just not a guarantee that all your symptoms will resolve and like you're going to be 100% when you're done. But I would encourage all of you guys to take care of it. And so, whether it's at a clinic like I work at, or it's a clinic close to you and you have pain, a lot of places will do a little bit of a free consult with you. If you're not sure if physical therapy is right for you, most places will do a quick screen for you and tell you if they think physical therapy benefit from you. So I would encourage you to seek that out a little bit as a potential. So I would say, now would be a good time probably to start looking at some of those individual questions, because, I was talking more general terms there. Hopefully, a little more of maybe what your pain is and where that would be. into what category you fall into versus muscle strain versus degenerative disc disease or arthritis or herniated disc. And there's a few other caveats that can fall into that I didn't dive into, but some of you might have. But I think now would be a great time to open it up for a few questions.
Excellent. Thank you, Matt. Such great information. We have lots and lots of questions. And so I'll try to sort of sift through these.
Sure.
Claudia asks if everyone in a physical therapy office has the same credentialing.
It's a good question. So, just like you would see your doctor, there might be a nurse practitioner or there might be a PA in their office. Similar situations that can happen in a physical therapy office. So typically it would just be like a physical therapist and then a physical therapist assistant in regards to, who's doing the evaluations and who's the medical professional that you're working with. But physical therapists do have physical therapist assistants that work with them. And they do go through a good amount of schooling. They just don't perform the initial evaluations, but they're well equipped to do most, and they collaborate directly with the physical therapist as to what that plan of care is. Now, physical therapist assistants don't do spinal manipulation. That is not something that they're necessarily trained in. That is one thing that they don't do. And so if a physical therapist thought you were appropriate for manipulation, they would keep you kind of on their schedule and work with you on that. So that's a good question. And you'll run across like physical therapist technicians that might help you get on a bike or do a couple exercises, but all that stuff will be determined by your physical therapist.
Okay. Someone asked, and this is a question I'll answer real quick, that if this presentation will be available from AARP later, and yes, it will be available on Facebook immediately when we're done, and then within about 48 hours, it'll be available on that virtual events page that I mentioned at the beginning of the presentation, that you can get to by going to aarp.org/mi, so the Michigan AARP website. So Barbara asked, is it only possible to get traction at physical therapy, physical therapists, or is there a home method?
Yeah, we teach people some self-traction. I mean, you probably have all seen or heard of like an inversion table, and that's in essence traction, right? You're kind of pulling through where you basically tip yourself partially upside down, not completely upside down. And that's a form where you end up getting traction through the hips, the ankle, and then into the back, to your back. But we definitely have some patients who do things like that at home. There's ways you can get a light amount of traction on your own, like if you're just sitting there right now and you put your hands in two fists and you put them down next to you and you straighten your arms out and you keep your belly muscles relaxed. Like that just at least takes a little weight off your spine. You can try similar forms laying down, but it's not as heavy duty as like there's like traction machines that we use in physical therapy clinics as well, or we'll put like a belts around you and pull with you. That's going to give you a little more decompression. Traction isn't necessarily about how much you decompress, like the intensity of it, that you just distracted enough that you're taking away some of your symptoms. That's the most important thing with traction. So, because if you pull too hard, it can aggravate joints and ligaments and things like that. So I always caution people, they're doing it on their own. If they're doing something like the teeter is one of the systems, or an inversion table, that they just do it in moderation and they don't just until they feel like some symptom relief. But we don't just do traction in therapy. We're doing it with some soft tissue massage. We're doing it with some light exercises so that you can work on bracing your spine, some of the smaller muscles as opposed to some of the bigger muscles. But there are definitely home ways to do that. And we usually instruct patients on how to do that. But you might like traction in a flex position or more of an extended position. So that's where the individualization comes from. You'd want your therapist to probably direct that a little bit. And just laying down is a form of decompression. So laying down for 2 or 3 minutes might lessen your symptoms and then get back and go. We just don't want you laying down all day.
Yeah. Got to keep those muscles fit in order to keep us moving, right?
Yeah.
I actually, related to that, Bruce asked about strengthening muscles in your lower back, and can that help with low back muscle pain?
Sure, it definitely can, right? And when you're stretching your muscles in your back, you're probably stretching your joints a little bit. But our body protects itself and reacts, right? Your back hurts and your muscles kick in to try to say, don't move because it hurts. And so your muscles can get very overactive and they can get actually painful too. A lot of times that's a secondary thing than a primary thing, but that's where like the stretching and the massage and things like that can feel very good to those muscles that like you run up your back or they run your side of your, the side of your hips a little bit, or your glutes, because people get a lot of pain in their glutes because that's where the kind of sciatic nerve runs. And so stretching out those muscles, those deep hip muscles, can be very helpful for some of those people, because if they're tight and they're pushing on the nerve, then that perpetuates the issue.
All right, so there are a couple people who mentioned that they've been to physical therapy and they've had injections, and the injections work, but their insurance company, or the newer insurance company that they have, doesn't want to pay for them, wants instead to have them take narcotics. And they want to know, basically the question is there a way the physical therapist can work with the insurance company to try to help get the PT covered instead of using narcotics?
So I don't necessarily know all the details in regards to what insurance company will cover what. Obviously that varies and changes all the time. So it's hard for us to do a lot of work with the insurance companies. Usually we're just providing the objective data that we've taken, and whether they authorize more, whether they don't. I know like a lot of insurances actually are doing some good things on the opposite of that, where they'll say, hey, you need to do some physical therapy before I do an MRI for you, because MRI doesn't treat you, it just gives you information. And I think those things are actually good for those people who should try a little conservative. And that's kind of moving more in that direction of like it's going to be cheaper for you to do a course of therapy than it is to just pay for the MRI itself, if it's not going to direct surgical intervention. But physical therapists can't really change or dictate too much with what the insurance is going to cover in regards to those injections. There may be certain loopholes and caveats that, like, the person who does the injection, that physician, that you might need to collaborate with. It might be every 6 months or whatever. And maybe that's where, if they only approve it, once every 6 months, then you do some injections and a little therapy to get you by that 6 months until they approve it again. So that would be a way maybe physical therapists can help out in that situation.
Okay. All right. Marianne asks, for low back pain related to muscle strain, is riding a bike good or bad for recovery?
We have many of our patients that are, back pain ride a bike, as long as we tend, in the clinic, we have a lot of ones that have like the back support versus like an upright bike, but even an upright bike can be fine. It just, can you get in a comfortable position and tolerate some of those things? Because biking is very similar to walking, can be very good, therapeutic for back patients. It depends a little bit on their tolerance to the certain position that a bike gets you in, because you're a little more flexed when you ride a bike, especially if you ride a road bike and you're out there riding a bike, you have to be flexed a little bit. As an example, like when my back was hurting me, I could walk much better than I could ride a bike. But there's many instances where bike riding, if your spine stays pretty straight, is really comfortable and effective for utilizing your leg muscles and facilitating some of the recovery.
A couple of people have asked about how do you choose a mattress, or should they get one of those special mattress pads to help alleviate pain? Do you have any comments on that?
Yeah. So, I mean, in general terms, right, you want to make sure if you have an older mattress, it's not sagging. If a mattress sags and you think about laying on your side, if you're a side sleeper particularly, or if you lay on your stomach, well, then your back's maybe a little extended if your mattress sags. Or if you're on your side, or your spine doesn't stay straight that way. So that definitely could affect how your spine is doing, because you're sleeping in there for hours on end. That being said, if you feel like your mattress isn't super old and is still in good support, how much the level of support, meaning how, is it a firm mattress, or is it plush, or does it have a pillow top? I think those aspects come down to your personal preference. And so there's not one way that, everybody has back pain loves a hard, firm mattress, because a lot of people won't, like, especially if you sleep on your side, because that pushes on maybe where you have a bursitis or something like that. So I would say make sure your mattress isn't super old or still feel like it's supportive and it's not sagging. If that's the case, then how much, whether you want a pillow top on that or they want it to be firm, is your personal preference. And I would encourage you to lay on the bed for a little bit and see how it feels. Because just going and buying a bed necessarily won't alleviate everything. I do have some patients who have the beds that are adjustable. And like, for example, if you feel better and your back's hurting a ton and you feel better in a recliner where your back's flexed a little bit and your legs are up and you're a little more of that kind of beach chair position, some of those beds people do like because it kind of gets them a little bit of tension off their hips or things like that. So if you're having a ton of trouble sleeping, those are other things to consider, but they can be more expensive as well.
All right. What is your opinion on CBD oil to assist with low back pain?
So more and more of my patients report to me that they use that. Do I like prescribe it or recommend it? I say, look, anything that can help you with that, that's natural and not addictive and habit forming, and I say go for it. You know, it definitely can help with people that have some pain. I've got patients and relatives that use it and they say, look, you know what, takes my pain down a little bit. It's not detrimental to the joints. And if that or some other things, like we have like BioFreeze in the clinic, right? It's a topical kind of analgesic a little bit. Anything like that that helps, I say go for it. I don't know, to be honest. I don't have research-driven data to support those types of things, so I can't speak to it that way, like that it's purely evidence-based. I'm just giving empirical evidence from some of the patients that I've seen. So that would be completely be up to you. I don't know that I can't give medical advice and saying you got to go use CBD if you have back pain, but it's definitely a potential option.
And I had some. I'm going to ask if they'll put up if our producer will put up the websites again, because I've had a lot of people asking for that. All right. Oh my goodness, we're actually over our time, but we'll do a couple more questions here. Let me find a couple here. We had, where's a good one? We have a lot of, go ahead.
If you're like, oh my gosh, I can't read all that. If you just look under, I think it's Choose PT, I think is the main, if like a searchable term for that one, that'll get you, I think, to where you want to be for some of those things. I think that's what it is.
So there's a couple people who've asked about what are the least intrusive methods for lingering or ongoing low back pain. And I know that they're at Peak Performance. You guys have a lot of tools in your toolbox, from dry needling and cupping and Graston, all kinds of different things. And those are all non-intrusive. So this particular person had a fractured disc and is asking, back a while ago, asking what's the least intrusive method that you can suggest. So, I just wanted to point out there's a lot of different tools in the toolbox that the OMPTs might have.
Right, and some of that stuff comes down to what you're trained in. If you've been trained a little more in, say, like cupping versus, use like Graston tools, or what's kind of like a scraping tool. That's just another medium of, most of those are instrument-assisted soft tissue mobilization, right, that you're talking about there. Dry needling is a little different, right? That's trying to get out some trigger points and help muscle relax, and that takes a little more skill training. And like, that's not necessarily that particular piece. The dry needling isn't part of the OMPT training. You can just get that kind of on your own in a particular course in a certain amount of hours. But a lot of those other things are instrument-assisted soft tissue mobilization. Whether I'm using something other than my hands to do it, so I don't kill my hands over time as a therapist. There's other things that we offer too, that your standard physical therapy would offer, like potentially ultrasound or electric stimulation can, help manage pain if you're in a lot of pain. That's where, like, people talk about like a home TENS unit. That's the same thing, right? Transcutaneous electric nerve stimulation. If you find something helpful in physical therapy with that, then you can sometimes work with your insurance to get one at home, or there's some pretty reasonably priced ones you can buy for home. But there's a variety of ways as Karen mentioned, to facilitate some of the things that do that. I mean, you can use kinesio tape, other things that applications that physical therapists would use to maybe inhibit or stimulate a certain muscle you want to kick in, or feel a little more support with some things, or help control swelling. So, that's a loaded question with a lot of potential answers, I think. But I appreciate the question. And the point is, pretty much everything you're going to get in physical therapy is pretty conservative, meaning, injections are obviously least conservative. There's a potential infection, there's a potential infection with surgery, things like, even if we've mentioned earlier, like CBD, like there's, other than probably skin reaction, there's probably not a lot of heavy side effects of that. Of course, there's always side effects. You could do massage and you could be sore afterwards or things of that nature. But I wouldn't, I would always default to what the provider, what the physical therapist, if you're in physical therapy, is most comfortable doing, because that's what they're going to be best at. And so, I might not be as good as like cupping versus something else. And so they're going to utilize what they're best at to try to help you treat that. If there's a particular thing that you really wanted and you're like, hey, I want to try that part of it, well, then they might recommend another provider in their group that could try that on you too. So that's always a possibility, right? There's multiple providers usually in most PT clinics, and they might have a little more subset in their specialties, or certain things that they're a little more trained in that they could do as well.
Okay, last question. There's been a lot of questions about exercises. And did the websites that you recommend have exercises on them? I know you talked about things you could do for rotator cuffs and things like that. Is that provided on those websites?
Just pulling up. I don't know if there are specific ones, again, because that gets very generic with.
So if not, are there any websites you would recommend, or where would you recommend people look for appropriate exercises, other than going to their physical therapist?
Yeah, that's tough, right? Because there's plenty of places that have a plethora of exercises out there. But I don't know if there'd be one in particular that I would say is like, oh, this is the site that I would, trust these exercises particularly to do, because there's so many different directions you can go at low back pain. And so it's not, there's not a generic prescription. Otherwise, there would just be a list of 40 exercises out there that would be, hey, do these if you have back pain. The ones you can't, that ones that hurt, don't do.
Right.
And so I wouldn't be comfortable necessarily giving out one. I maybe can do a little more digging on that you can maybe send to your people if there is one more, but I don't have one particular that I'm obviously sending my patients to, because I'm just giving them an individualized one when they come in. But I can do a little more digging and potentially send something to the people that are watching after this.
Great. Well, thank you so much, Matt. Great information. I know that there's been lots of thank yous coming through in the comments. So, and I add my thank you to you also. Just a reminder to everybody that you can watch this. This will be available again immediately at the very top of our Facebook page. If you wanted to review some of the things that Matt covered, it will also be available on the AARP Michigan virtual events page, which you can get to by going to the AARP Michigan website and clicking on the virtual events link. And you can find all kinds of great things. We are collaborating again with Peak Performance. And well, we're collaborating all year long. Once a month, we're doing a health and wellness presentation. This is one of those. And we will be having in May, June, and July, actually every other week, we have a series on diabetes coming up, which you might want to check out. So, and next month we are doing urinary incontinence. Everyone's the most sexy presentation. So thank you, everyone, and we look forward to seeing you next time.
Thank you.